We'll hop right into our second episode of the Maryland Rural Health Association's podcast, The Voice of Rural Health. The first episode we had on Dr. Howard Hack from the Maryland Department of Health, giving us a great update on the COVID-related activities and some of the therapeutics surrounding COVID. Today, I am proud to announce we have another special guest on from Western Maryland this time, David Stewart, the AHEC West Health Insurance Program Director there. David, it's good to have you on the show.
It's great to be here.
So would you tell me a little bit of brief background on yourself and a little bit about what you do at AHEC West?
So my program, the Health Insurance Program, is a partnership with the Maryland Health Benefit Exchange. And while folks might not be familiar with the Maryland Health Benefit Exchange, they probably are familiar with Maryland Health Connection, which is Maryland's Affordable Care Act marketplace. Maryland, we have our own state-based health insurance marketplace. And as part of that effort, the Maryland Health Benefit Exchange funds regions. It funds organizations in 6 regions throughout the state to... Can you hear the siren? Sorry.
I can hear it, and that's okay because in my office, the same thing happens. So
okay.
you can continue.
So in Maryland, there are what are called connector regions, and organizations are funded to provide application assistance and outreach activity so that folks have help applying for health insurance, help understanding when they qualify to apply, and what they actually qualify for, because there are several health insurance related programs and not one size fits all. So we've been doing that now. This is we're going into our 7th year of doing this. So we help people enroll in health insurance. We help people find the resources that they need to do that. And we help them understand their health insurance.
No, that's fantastic. That sounds like a lot of work that goes involved with that. And so your services, are they limited to a specific geographical range, Allegheny County?
My region is Washington, Allegheny, and Garrett counties. Those are the consumers that we serve. However, the information about what we do, it applies across the state. Because I have, colleagues everywhere in the state of Maryland, sister programs that do exactly what we do. So no matter where you live in Maryland, there is free assistance with health insurance.
That's fantastic. And you mentioned that the landscape for ACA health insurance has greatly changed, and I think it changes really year to year. Can you give me a little update on some of those changes?
Yeah, I would say folks should feel good about living in Maryland because Maryland has done a lot of work to continually expand access to health insurance, to lower premiums. For example, our gold plans have the second lowest base premiums in the country. Our overall premium prices have gone down. Now they're going to bump up. So I just a heads up for people, they're going to go up a little bit. We don't know how much just yet, mostly because of COVID and things related to just, our whole world is a little turned upside down in some ways right now around the cost of anything. And healthcare is definitely part of that general trend. But the thing about Maryland is we will be less impacted than other areas, right? Because there's lots of programs in place. And so this landscape change that I talked to you about earlier is they have put significantly more funding on the table in rural areas specifically for outreach. And the idea is there are insurance agents and brokers all around the state and in any region, my region, that can help people with health insurance. So I'm keeping my group of navigators that provide that direct assistance, but we're also going to increase the ability for people to connect to an insurance agent or broker. And then I'm going to be able to double the size of my staff, and that doubling is going to be outreach workers. So hopefully in the not too distant future, you will, in Washington, Allegheny, and Garrett, you're going to be bumping into my outreach workers who are carrying the message just about anywhere and everywhere they can. And that's significant. Like for me personally, I've always had the bandwidth to do the consumer support, the direct application assistance. But I have honestly struggled with the ability to attend events, create materials, and get the word out. And what MHBE has asked us to do is to focus on the highest uninsured neighborhoods. They are getting us down, not just to the zip code level, because in rural areas, zip codes are quite large, but they have focused on neighborhoods. And so, for example, I will be opening 2 outreach centers. In Hagerstown, we're going to be part of the Horizon Goodwill Healthcare Hub, which will have things like a grocery store, a doctor's office, and a dentist's office, along with job training and other programs and my program. So that's a big deal. We're going to be part of the healthcare hub in Hagerstown. We'll be right downtown within walking distance of just about every agency you can think of, and the transportation center. In Cumberland, we're going to have our own storefront at 138 Baltimore Street, and it's in the same building as the unemployment office and legal aid, Department of Rehabilitative Services. We're right around the corner from the main transportation hub. So we're going to have physical locations specifically devoted to providing not just health insurance resources, but all kinds of resources. They have asked us, for example, to have computers there that people can schedule time on. They've asked us to be able to make photocopies for people and scan documents for people. They have asked us to connect to other service agencies and have those people come to our space and offer their services at our locations, right? And I don't have the full list of things that are going to be offered, but I'm really excited about this. I mean, it's like I have a brand new job, and all of our workers, and this is getting back to, are going to be, all our outreach workers are going to be community health workers. If they're not already certified, we're going to take them through the training process and get them certified, because we are going to be able to take a holistic view of a consumer, of a person coming in. I'm perfectly happy if they have health insurance, but they want to come in and ask for help with something else. And that's what community health workers do. They take this 360-degree view of a person and they say, well, let's find you help with that. Even if we don't have it right here, right now, this moment, I can help you get connected. And that's a sea change. And that is a change that is being replicated by all of the other programs that provide health insurance consumer assistance in the state. Everybody's doing it. And I think it's great.
That is absolutely fantastic to hear. And it sounds like that there's a lot of great things coming down the pipeline for you and your organization. There's a couple of things that I wanted to touch on. One, the community health worker role has taken on a lot of different, they've taken on a lot of different roles, not only across the country, but here in the state of Maryland. I've had the pleasure of working with several of them, and they do help really get that 360 view of the entire patient and their family and help to address a lot of those issues. And AHEC West, correct me if I'm wrong, is one of those training hubs in Western Maryland?
Yes, we are. And I will tout my own horn just a little tiny bit. A few years back when I had a different job, I wrote a grant that brought an oral health community health worker, which I think was the first one in the state of Maryland, and they were housed at AHEC. I was working at a different organization at the time, but AHEC in particular in Western Maryland has been one of the organizations fully committed to and behind community health workers. And I just can't think of a group of people better suited to provide a broad range of support to people, right?
Absolutely. And I also, too, work with community health workers, and they are, again, they do that holistic approach, and they really take the entire patient and all the situations that they're going through to address a lot of different issues. And they're multifaceted. They are like that survival tool, I call it. They can do a lot of different things to help the patient. And I think it's fantastic. You know,
the Swiss Army knife.
The Swiss Army knife of healthcare. I love that. I love that. You also mentioned, doing a lot of increased outreach, having some different storefronts in some areas. Are there any ways that MRHA's members or community-based organizations or anyone hearing this podcast can help you? Should they be inviting your team when they're up and running to events? How can they help?
Well, absolutely. We would love to be, depending on where they are, you can get connected to the consumer assistance program for your area, right? Not just anybody in Allegheny, Garrett, and Washington County that wants our involvement with activities, I'm on board. It could be a food giveaway or, something like that, and you need bodies, I will certainly make time for my community health worker, my outreach worker to be there to help with that effort. Yes, give us a call, but not just us. If you're in some other part of the state, there are other programs that you can get connected to. And if you want to start by calling AHEC and asking for help getting there, but probably the easiest way to find these programs is to go to the marylandhealthconnection.gov and look for local help. There's a section where you can click on that says find local help, and that will identify by county the other programs that are doing the same thing as mine.
That's absolutely fantastic, and thank you for that information. One of the things that, in my previous work, I supervised some insurance navigators. I wasn't necessarily directly involved. I never had that full knowledge that you have. But one of the things that kept coming up during COVID was these special enrollment periods. Can you tell us a little bit about those?
Yes. So normally, the opportunity for someone to enroll in Maryland Health Connection Marketplace Insurance is November 1 is when it starts. And when it ends, changes year to year, right? Some years it's December 15th. This past year it was January 15th. But open enrollment for health insurance starts on November 1. And it's the time of year where anyone who wants to can enroll in Marketplace Insurance. What navigators do, one of the main things that we do is we also screen people for eligibility for financial help to lower premiums and other costs. But just in terms of enrolling, it's November 1 to whenever it ends, December or January 15th. Now, a special enrollment period is something that recognizes that, hey, people lose insurance at other times of the year. Their jobs change. They're laid off. Their employer decides no longer to offer insurance. Okay, so there's lots of reasons that for someone to need to enroll in health insurance at other times. And so, for example, if you lose your health insurance for any reason other than I just don't want to pay my premium, you qualify for what's called loss of coverage special enrollment period. The state of Maryland decides to have their own special enrollment periods for a variety of different situations. The standard ones are you have a birth or an adoption, right? So that provides the family with a special enrollment period. If you move to Maryland from another state, right, that's a special enrollment period. There is, starting July 1, what I consider one of the most important special enrollment periods, which is, we're calling it the low income special enrollment period. And I don't have exact numbers for this, but there's a thing called the federal poverty level, and a lot of benefits are based on where you fall on a scale, on an income scale, right? So in this case, if you meet 150% of the federal poverty level, which I believe is right around 19,000 and change for a single person, you can enroll year round if you don't already have health insurance. So eligibility for free health insurance through the state of Maryland starts at 100. It's below 138% of the federal poverty level. There's a slice of people between 138 and 150. Probably many of the people who listen to this podcast will know what those income levels are. They're pretty easy to find out, but what's new is those folks can enroll year round. And that's not been the case in the past. So that's a particularly important one. There's also, when someone becomes eligible for the financial assistance that lowers premiums, that's a special enrollment period. And what that means is you may have purchased other health insurance, and for whatever reasons, you weren't eligible to get the financial help. But if that eligibility changes, you're allowed to come to the marketplace and say, hey, I now know that I'm eligible for financial help, and we can do that. And that's one of the main reasons why I think people should give their local connector program, their local consumer assistance program a call, is to find out what your circumstances actually are. Because one of the things that's hard, there's so many special enrollment periods, we could do a whole podcast on them. But the bottom line is MarylandHealthConnection.gov, AHEC West, and other organizations around the state have people available year round to just explain all this stuff to you in detail, and folks can learn what their actual eligibility for whatever is. And that's what I tell people about my program. We're not paid whether you enroll in health insurance or not. We're just funded to provide information. And so no one who comes to their local consumer assistance organization has to worry about being pressured to buy anything or purchase anything. The job of all the connector programs in the state is to provide information. That's what we do. And what we have learned is, even today, over 10 years into the Affordable Care Act, so many people do not know what they're eligible for and what's truly available to them. And that's our job, is just to provide that information.
That is fantastic. And we all know that rural areas, especially of Maryland, usually always have the highest uninsured rates of consumers, and it needs special attention to really address that health equity and really those social determinants of health. And as we wrap up today's podcast, is there a website that people can go to for your contact information?
Yes.
Learn more about the program you have offering. And if you had to summarize it up in 60 seconds, what are some of the most important points that people should take home?
Here's my most recent important point. Of the uninsured people in the state of Maryland and in rural areas, half of them qualify for free or very low-cost health insurance. Half, right? So of the people who currently don't have health insurance, most of them don't understand that they would pay a very small amount, if any, for health insurance. So that's the big point. Now, ahecwest.org, which is ahecwest.org, you can look at the top of the page there and you'll see health insurance. Click on that, and that connects you to this program. We also have a 800 number, toll-free number, which is 888-202-0212.
That is fantastic. Thank you again for that information. And again, we want to thank David, the AHEC West Health Insurance Program Director, for his wonderful overview of all of the changing landscape that has to do with ACA health insurance and the special enrollment periods, the Maryland Health Benefit Exchange, and it really exciting things coming down the pipeline for his team as he expands to increase some of the outreach in some rural underserved communities. And we at MRHA, thank you, David, for all the hard work that you're doing, and we appreciate you on the podcast.
Well, you're very welcome.